Welcome, curious minds, to another deep dive.
Great to be diving in.
Today we're tracking, well, a new shadow on the horizon, the Nimbus variant.
NB 1.8.1 yet.
Right, it's spreading fast, and it's kind of forcing us to ask, is this, a new chapter or just an echo of what we've seen?
Mm-hmm. A familiar pattern, maybe?
So our deep dive today, it really aims to solve that riddle. We'll be dissecting some key sources.
Yeah, we've got a briefing document, expert takes.
Exactly, like Dr. Liana Wen's insights. The mission is to distill the crucial facts for you. Cut through the noise about Nimbus.
To what really matters.
What it is, how it's spreading, the health impact, and what precautions make sense. And this is all based on data up to June 7, 2024.
And what's really fascinating here is just how relentless these viruses are. Always evolving.
Constantly changing.
Yeah, each new variant means we have to, well, quickly reevaluate everything, adapt our strategies.
Right.
So the deep dive, it should help you grasp the nuanced reality of Nimbus, its contagiousness, what it means for you.
Okay, let's unpack it then. First off, what exactly is Nimbus? What are the reports telling us about where it came from, how it's classified?
So Nimbus, officially NB.1.8.1, it's classified as a descendant of the Omicron strain.
Okay, so it's in the Omicron family.
Exactly. And the World Health Organization, the WHO, they've tagged it a variant under monitoring.
Under monitoring. What does that mean compared to, say, a variant of concern?
Good question. It basically means it's on their radar. They're actively tracking it, watching for signs it might be, more transmissible or cause more severe disease. But it hasn't hit that higher threshold yet, the one that might trigger more urgent, like global actions.
Got it. That's a helpful distinction. So, behavior-wise, the big questions are always contagiousness and severity. Is it spreading faster? Is it making people sicker? What are the sources saying there?
Well, the data, it strongly suggests it could be more contagious than earlier circulating variants.
Okay.
And that's because it's outcompeting previous strains. We're seeing it become dominant pretty quickly where it shows up.
Right. It's pushing the others out.
Exactly. But, and this is really key, nothing so far suggests it is more severe.
Okay, that is important.
Yeah, WHO surveillance data, it specifically says they do not show that it has increased severity compared with previously circulating variants, which is, huge relief. Helps manage public anxiety, too.
That definitely is a significant relief. But, okay, what about immune escape? Now, for listeners, that's basically when the virus changes enough that our immune system, from vaccines or having had COVID before, doesn't recognize it quite as well. Is Nimbus doing that?
Exactly right. And the lab data, the stuff cited by WHO, it indicates it could have some immune escape.
Some escape. Okay.
Meaning our immune systems might be, a bit less effective at fighting it off right away. So that hints at a possible reduction in vaccine efficacy compared to the older strains. But it's also important to remember it's a close descendant of other strains against which the vaccines have efficacy.
Right, so it's not totally new.
Not totally new. So the big question is, how much protection do we still have? And, who retains that protection?
Okay. And symptoms. Are we seeing anything new or really different with Nimbus, or is it pretty much business as usual there?
Yeah, broadly similar symptoms to what we've seen with other COVID variants. It can range, Sometimes it's like allergies, stuffy, runny nose. Other times more typical cold or flu symptoms, fever, sore throat, fatigue, headache, muscle aches.
Usual suspects.
Pretty much. Some people might get a cough, breathing issues, nausea, vomiting, diarrhea too.
Right.
But the critical point is, even if the symptoms feel familiar, that risk of getting really sick, needing hospitalization, or developing long COVID, that risk is still there.
So similar symptoms don't mean less risk overall. That's vital. Okay, so if it is more contagious, where is it popping up? What's the global picture on its spread and potential surges?
Well, reports show Nimbus was pegged as the cause of a recent COVID resurgence in China and also several other Asian countries.
Okay, so it's making waves in Asia.
Definitely. And experts are already predicting we'll see an increase in cases in Europe, too. It's really showing it can spread widely.
Okay, now here's where it gets really interesting for us. What about the United States? Based on that June 7th data, what kind of footprint is Nimbus making here?
Right. So in the U.S., NBB 1.8.1 represented about 1/3 of new COVID-19 cases as of June 7.
Wow, a third already.
Yeah, and that's a huge jump from just 5% of new COVID-19 cases only a month before that.
5% to a third in a month. That's fast.
That kind of exponential growth, yeah, it always makes you sit up and pay attention.
Absolutely. So does this high transmissibility plus that potential immune escape we talked about, does it point towards a distinct possibility of a summer wave like we've seen in past years?
It absolutely does, yeah. The sources indicate a summer wave is a distinct possibility.
Yeah.
Could be triggered directly by Nimbus, being more contagious, having some immune escape.
Right.
But it's also important to consider a wave could happen simply because overall population immunity is declining. Less recent infection, vaccine immunity waning.
So a combination of factors.
Exactly. This new strain hitting at a time of less recent COVID-19 activity could definitely kick off a wave in the coming months. It really does echo previous patterns.
Okay, so given this potential summer wave and the immune escape stuff, what's the latest thinking on how well the current vaccines work against Nimbus? And what about, looking ahead to new vaccine formulations?
Yeah, so the exact effectiveness, the precise number for existing vaccines against MB.1.8.1, well, it's not known because of that potential immune escape.
Right, it's still early.
Exactly.
Mm.
But because it is a close descendant of strains where vaccines do work, the expectation is they probably retain some efficacy.
Some protection is likely still there.
Probably, yeah. And looking ahead, federal health officials, they're expected to decide on the formula for this fall's updated COVID-19 vaccine very soon.
Okay.
And you'd assume they'll be aiming to make sure it works well against Nimbus.
That makes sense. So for you, the listener, trying to figure this out, who should be thinking about getting vaccinated now? Especially before new vaccines arrive, or maybe the guidelines change. It seems a bit complicated right now, doesn't it?
It certainly does raise important questions, yeah. And the guidance is pretty nuanced.
Okay.
For people 65 and over or who have chronic underlying medical conditions, the advice is to consider getting another dose of the vaccine now if they are eligible.
So for the more vulnerable groups.
Right. The idea is it gives additional protection in case there is a summer wave. And crucially, getting it now doesn't stop them from getting the new fall shot later.
Okay, that's clear. What about younger, healthy folks?
Well, the sources say some who have not yet received the 2024-25 formulation also may consider getting the vaccine now before guidelines change, and they may no longer be eligible.
Ah, so eligibility might change.
It might. And it's worth noting, the landscape, it has been shifting. There were recent statements from HHS Secretary Robert F. Kennedy Jr. saying COVID shots are no longer recommended for healthy children and pregnant women,
Right, I saw that.
though access for kids remains. And there's a newly reconstituted panel of CDC advisors. They might issue different recommendations later in June. So it's a dynamic situation.
Definitely sounds like it. So for anyone trying to make a decision right now, amidst all this, what's the clearest, most consistent advice?
The clearest advice, really, is that individuals should discuss their specific medical situations with their primary care physician.
Talk to your doctor.
Exactly. They know your health history, your risks. They're best placed to give that personalized guidance.
Makes sense. Okay, beyond vaccines, what about the basics, the tried and true precautions? Do the sources remind us what's still relevant for reducing risk, maybe even more so with Nimbus?
Absolutely. The message is the same precautions we've been discussing throughout the COVID-19 pandemic still apply. Because fundamentally, COVID-19 is a respiratory virus that could be airborne.
Right, so ventilation, hygiene.
Ventilation, hand hygiene, being smart about crowded spaces, especially indoors.
And for people who are particularly vulnerable, or maybe folks interacting with them, any specific actions highlighted?
Yeah, the reports really emphasize that individuals should be on guard, particularly in crowded indoor settings.
Be mindful of those spaces.
Right, and people who are especially vulnerable, they should really try to avoid those settings if possible.
And if they can't avoid them, like public transport or something.
If avoidance isn't practical, say, a busy train station, then they should consider wearing a well-fitting N95 or equivalent mask.
Okay, masking up in high-risk situations.
Exactly. And one more thing, people visiting vulnerable individuals like elderly relatives, they may wish to avoid higher-risk settings in the days before the visit, just to cut down the chance of spreading not just COVID, but other respiratory bugs too. It's about those layers of protection.
Layers of protection, good way to put it. So today, we've really taken a deep dive into this Nimbus variant. We've peeled back the layers on its characteristics, the rapid spread.
Yeah, the vaccine nuances.
Exactly, that nuanced advice. And the fact that those basic precautions, they're still so important, all based on that June 7th data. It's a powerful reminder, isn't it? Staying informed isn't just about knowing facts, but understanding what they mean, especially as things keep shifting.
It really is. And this deep dive, it brings home, I think, a really important question for all of us.
Yeah.
As new information keeps coming, new variants pop up. How do we, as individuals, as communities,
Yeah.
how do we navigate these evolving guidelines? How do we make the best decisions for ourselves, balancing that personal caution with, well, wanting to live our lives?
Balancing caution and living freely. That's
Yeah.
definitely something for you to consider as you go about your week. Thanks for joining us for this deep dive.
Yeah, I hope it was helpful.
We really hope this has given you a clearer picture and maybe even stirred a little more curiosity.